Hello and welcome to another monthly briefing. Amazingly, it's October, nearly November, and so we start thinking about winter. And when I think about winter, I think about flu jabs. Our flu campaign has got off to a flying start this year. We've had 673 people take up the injection in the first 2 weeks. That compares to 382 last year, which is an increase of about 76%, so great. We've had a high level of clinics this year, and we started our campaign earlier. So that may explain why more people are having the flu jab in work rather than with their GP. What we want you to do is to take advantage of this free offer to protect yourself, your family, and of course our service users. Here is some information on how to book your flu jab. And now I'd like to hand over to Simon Truelove, who's going to give us some information on our finances.
Thank you, Hayley. My name's Simon Truelove. I'm the new Finance Director for the organisation. I come at a time to this place when the NHS is facing significant financial challenges. And we hear sort of within the media a number of organisations within the local vicinity which are really challenged. And unfortunately, AWP is heading into sort of a challenged period where our finances are becoming more and more sort of difficult. Services are under significant pressure in respect to the demand which they're having to respond to. We have continuous challenges in respect to our workforce and being able to recruit substantively to the posts that we've got available, and having to end up using agency staff and increased amount of bank nurses, and all of that is putting significant pressure on the organisation. We've also got some significant issues around our estate which we're having to respond to, and when you bring all of this together, unfortunately the financial position is taking us into a deficit state. So as an organisation, we're working with NHS Improvement to be able to look at areas where we can sort of save money. We will need to consider sort of for non-clinical posts, looking at actually are they essential? Do we need to actually sort of recruit into them at this point in time? Could we do something differently? We're also looking at what expenditure we can either slow down or stop if it's not deemed to be non-essential. What is really important is that we need to focus all of our effort on ensuring that our clinical services can be maintained. That is the absolute sort of paramount and the focus of the work. I'm working very hard with my finance team and my other directorates to ensure that the departments have got the right information and knowledge to be able to make informed decisions, because it is going to be a difficult time over the next few months. NHS Improvement will be requiring us to deliver a financial recovery plan to ensure that we sort of bring the organisation into a stable financial position. From a cash point of view, it is really imperative that we that we continue to be able to pay our suppliers. That has been an issue over the last few months. We have been able to secure a loan from NHS Improvement, which has been able to bolster our cash flow, and we'll work with them to ensure that cash doesn't sort of end up being a problem for the organisation, so we can maintain the sustainability of our services going forward. So I hope that you will respond to that challenge which the organisation sees it's within. I'm very much wanting to ensure that my services are providing the services that you require to be able to make those informed decisions, and I do truly believe that we can sort of get ourselves out of these challenges, working with our commissioners to ensure that we are paid for the services which we provide, and that we are responding to the requirements of the 5-year forward view for mental health services. Thank you.
Thank you, Simon. Earlier this month, I was really pleased to open the Staff Awards ceremony. This is one of the highlights of the AWP year. It was a fun and thoughtful event with plenty of laughter, and so a huge thank you to everyone, both behind the scenes and in front, for making it such a success. The evening belonged to all of you, our staff, even those who weren't nominated, and it showed the passion and commitment of all of our colleagues. A few moments that I really enjoyed included the Reverend and irrepressible MC, Dr. Simon Manship, and the lesson that Secure Services staff gave us in how to party. So well done, everyone. That brings another month to a close. All of the questions we receive from your discussions on the video are available on our space, plus the responses that we make. So thank you for joining me and for all of your hard work. See you next month.